Good afternoon, and thank you for joining us. Today is Tuesday, January 4th, and on today's briefing, we'll hear from Mayor Cavalier Johnson, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here. And Mayor Johnson, I'll hand things over to you to get us started.
Well, Catherine, thank you very much. Happy New Year, everybody. Good afternoon. I want to start off by wishing everybody a happy New Year and welcome to the year 2022. Hope that everyone had a healthy and restful holiday season. On a personal COVID update, I know there's been a lot of outreach, since my own COVID diagnosis. I shared this weekend that during my routine regular COVID-19 testing that I received a positive result from an at-home test. I'm still feeling fine. I'm experiencing some mild symptoms here at home, so please excuse me if I end up having a cough during the course of this presentation here. As I've shared previously, I am vaccinated fully. I'm also boosted, and I routinely wear masks in public. I'll continue as well following the precautions public health experts recommend for people who have tested positive for COVID, and will carry out all my mayoral duties from home, such as I'm doing now. On some of our COVID-19 gating metrics, an update from our metrics for this week. We remain in extreme transmission category for COVID-19 cases per 100,000. We're up to 926 cases per 100,000, and our percent positivity rate also remains in the extreme transmission category as well. That's up to 37.4%. Our vaccination rates here in the city of Milwaukee were 61% of adults. Those are individuals 16 years of age or older are fully vaccinated. We also are at 66.2% of adults who have received at least one dose of a COVID-19 vaccine. And we've got 34.7% who are fully vaccinated and who also have received a booster dose. Obviously, that's something that we want to continue encouraging to get those numbers up. As we see from the data, we're experiencing a dramatic increase in cases and hospitalizations. Our mitigation measures, vaccines, first and foremost, boosters, of course, testing and masking, they continue to be effective in fighting the virus. While we experience the surge, I want to encourage folks to consider the following practices as well. So if you're in a public setting, whether you're in the city or elsewhere, please make sure that you wear a mask. The health department has a mask advisory out there. Please make sure you follow it, and consider upgrading your cloth mask to a surgical mask or a KN95 option. They're more effective against COVID-19. And if you're eligible and haven't yet, please make sure that you go get your booster dose. If you haven't received your first dose of the vaccine yet, it's not too late to take this important step in protecting yourself as well as your family and our broader community. So please make sure that you follow up and utilize the most effective tool that we have available to us right now, and that's vaccination. On upcoming clinics, the Milwaukee Health Department is offering 2 vaccine clinics this Wednesday. That's tomorrow, January 5th. One will be from 1 o'clock until 4 p.m. at Ascension All Saints Family Health Center. And then from 3 to 5 p.m. at the Golden Center, the COA Golden Center. The lower number of clinics this week is due in part to a shift in health department staffing to testing to handle the influx that we've seen for that. So that's why we see a lower number of these clinics this time around. Vaccines and boosters are still always available at the health department's community locations at the Northwest Side Health Center, the South Side Health Center, as well as the site that's been set up in the Menominee Valley. I would like to touch on some of the outreach that we've had regarding a mask mandate or considerations thereabouts. I've received questions and comments about the potential for future mask mandates in the city of Milwaukee. There are people who I believe, certainly in good faith, are asking for a return to a mask mandate in Milwaukee, and I really do appreciate that. I am, as mayor, relying on the best advice that I receive from public health professionals, and I can assure you that any decisions that I make, that we will make, will be made around masking to be done in consultation with our public health professionals who are experts on COVID-19. So this is not merely a political decision. It's one that's being done with consultation with folks who are experts on COVID-19, who are experts in health as well. So with that, Catherine, I'll kick it back over to you.
Thank you, Mayor Johnson. And now we'll hear from Dr. Ben Weston.
All right, thank you, Catherine. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 1,168 new cases per day and about 3 deaths per day. Our overall trends, particularly the number of cases and hospitalizations, have been staggering. Our case numbers are at an all-time record. Our positivity is at a record high of 34%, and our hospitalizations are also at a record high at 635 people hospitalized with COVID. And the trends are near vertical. And despite all this, Wisconsin is only in the middle of the pack of disease burden when looking at other states. The East Coast is getting hit much harder, which means we likely have worse days to come. Well, there's been many CDC and FDA updates lately, modified isolation for those infected without symptoms, quarantine changes based on booster status, expansion of boosters to anyone age 12 and older, and a shortened timeline until boosters should be administered from 6 months after second dose down to 5. Now, the rationale for many of these changes is the same, and that's the importance of protection specifically against Omicron from the booster shot. Now, I'll tell you, I worked quite a bit in the emergency department over the holidays, and the number of people with COVID there is really astounding. But what's abundantly clear when seeing and caring for patient after patient with COVID is the impact of the vaccine. Those who are vaccinated, and particularly those who are boosted, while yes, they can have breakthrough infections, these infections tend to be much more mild. Now, meanwhile, those who are not vaccinated, those who opted against the protection of the vaccine, whether due to misinformation, misprioritization, or other societal barriers, do so much worse. The vaccine is very often the difference between whether you go home to lay on your couch and watch movies, or you're admitted to the hospital, given steroids to decrease the inflammation in your body, laid face down to try to redistribute the fluid that builds up in your lungs, and put on oxygen to keep your organs functioning. 635 people are currently in our hospitals in the county with COVID. Now, I hear a lot of questions about, are they there with COVID or are they there from COVID? Is COVID your main reason for being admitted? I'll tell you, of the many, many patients that I've admitted who were COVID positive, I can't think of one where their COVID positive status will not adversely affect their ability to recover and go home and leave the hospital as soon as possible. COVID infection may exacerbate other chronic conditions such as heart disease and kidney failure. So right now, COVID is affecting these folks, but also so many more, either through the health system capacity issues, which is limiting access to otherwise routine care, or through school closures resulting in virtual education, or through airline or restaurant or other business closures or limitations due to the impact of COVID. This surge in cases is unlike any we've seen in the last 21 months of the pandemic. And how our health systems can maintain operations will remain a challenge in the face of this influx of cases. Vaccination and boosters are critical to protect you in the weeks and months to come. And in the short term, masking with a KN95 or N95, as well as distancing, will be critical as we yet again look to flatten that curve and blunt the impact of this wave of infections. We will get through this, but we must work as a community to ensure we emerge on the other side as safely and healthy as possible. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. The newest gating metrics, while not surprising, are alarming. This current trend is indicative of the presence of Omicron, which is rapidly spreading throughout the city and state. When you look at how this new variant behaves, it's important to recognize that Omicron began to emerge in Milwaukee right as we headed into the holiday season. This created a perfect storm, with a more highly transmissible variant emerging while people are traveling and gathering in their homes with friends and family. While PCR tests do provide the most accurate results, there are other options for testing that we recommend and can be utilized. Rapid antigen tests are still a good tool to use if you're recently exposed or asymptomatic. While those rapid tests have shown to have lower sensitivity and specificity overall than PCR tests, they're most reliable when an individual is positive with symptoms or negative without symptoms. If you test positive with a rapid test, you should isolate in accordance with CDC guidance. You do not need to follow up with a PCR. If you're symptomatic and negative, we do recommend a follow-up PCR test. The Milwaukee Health Department COVID response team has worked tirelessly to meet the increased demand for COVID tests throughout the holidays. Since the week of Christmas, the Milwaukee Health Department sites have administered 16,000 free COVID tests to our community. We appreciate the patience and respect of the vast majority of Milwaukeeans that have extended their patience while waiting in line for a COVID test. We know those lines have been long. However, due to multiple counts of individuals attempting to cut in line or cause altercations with others waiting in line, the Milwaukee Health Department has increased security at our testing sites. If someone deliberately cuts in line or causes an altercation, they will either be asked to move to the end of the line or asked to leave. Again, we understand that demand is high and the lines are long, and uncertainty and stress certainly cause heightened emotions. Please continue to exercise patience with one another while our COVID response team works as hard as possible to provide this service to our community. I want to extend my deepest gratitude to my COVID response team. Over the past few weeks, we've had MHD staff from other programs within the department step out of their normal roles to assist with the testing and contact tracing efforts. My team's willingness to step up and step in to help the Milwaukee community is unmatched, and I cannot thank them enough for their continued hard work over the past 22 months. Due to the influx of cases at the Milwaukee Health Department, our contact tracing is now focused on individuals under 18 years old, and in addition to providing support for schools and congregate living environments. Anyone who receives a positive COVID test result should proactively reach out directly to those they have recently come in contact with to tell them and encourage them to get tested. We know the way out of this pandemic is vaccination. We've been at this for a long time, and we know the common sense safety measures we can take to protect ourselves and our community. I'm asking everyone to do their part to help stop this spread. This includes getting vaccinated and boosted as soon as you're eligible, avoiding large indoor gatherings, and wearing a mask when you need to be in public. Together is the only way we can protect Milwaukee. Thank you.
Thank you, Commissioner Johnson. That concludes our briefing. So we will now move into the media Q&A portion of our briefing here. I'm seeing several chats coming through. First from Ben Wagner with WISN 12. He's asking, on testing, is 16,000 tests the most the county has conducted in a 2-week span? What has been the typical number of tests at other points during the pandemic?
So I can start. The tests during the pandemic have ranged from a little over 1,000 tests per day up to about 7,000 tests per day. Right now, as a county, we're averaging, the average is about 8,000 tests a day, but there's days where we're hitting close to 15,000 tests in a single day in the county. So we're seeing testing numbers unlike anything during the pandemic in the past.
And that 16,000 test number is specific to the City of Milwaukee Health Department sites. So we have tested 16,000 people just within the City of Milwaukee at our 3 sites. On average, about 70%, 70 to 80% of the people who are tested at those sites are City of Milwaukee residents. And we typically average, 250 to 500 a day prior to the holiday.
And Commissioner Ben has a follow-up question on altercations at testing sites. He's wondering if you can explain the nature of these incidents. Are these typical arguments with other people or staff, or have some incidents become violent?
So I can't speak specifically to what has occurred, but I do know that it's involved both people who are in line, so other people, and our staff. And I know that there have been some threats of violence. So again, we have stepped up our security, and the Milwaukee Police Department has been a tremendous partner, is assisting at all 3 sites.
Ben's third question is also directed to our city representatives. Some restaurants have announced that they will require proof of vaccine to enter. Is the city planning to leave vaccine proof up to individual businesses, or is it likely there will be a blanket vaccine mandate in the future, similar to what's now required in Chicago?
So as we worked this summer, worked through this with Summerfest, at this point, where individual businesses are making that decision to require vaccine or proof of vaccine. Similarly, our theater groups are doing the same thing. We are very supportive of that decision and are doing anything we can to assist organizations and businesses that are requiring vaccine to make it work for them.
Eric Gunn with the Wisconsin Examiner is wondering, is the use of home tests becoming so widespread that the data that county and state health agencies are becoming less complete regarding the number of people tested, testing positive, and testing negative?
It's a great question. I think the answer is yes, absolutely. But since we don't have an eye on those tests, those at-home tests that people are doing, we just don't know. We don't know what percentage of cases are out there that are not being recorded. But I think in the end, I don't know that that number matters as much as the trends matter. There's a clear uptick in the number of cases. There's a clear uptick in the amount of positivity, and there's a clear uptick in hospitalizations. So I think we still know broadly what's going on, but the short answer is yes, we don't have an eye on all those home tests and what they're resulting.
I believe we tackled the CBS 58 question. Happy to follow up if you want additional context. So I will move to Corey Hess's question with Wisconsin Public Radio. She's wondering, there are some predictions that the Omicron wave could possibly be the start of the end of the pandemic. There's modeling that shows this surge could be intense, then fade by the end of the month. Could this be true?
So when we look at South Africa, which has been experiencing Omicron and keeping track of the data as much as anybody, it looked like it took about a month for the data to peak, for the cases to peak, and then they started coming down. What we don't know yet is whether it comes down back to that baseline. Hopefully it does. With Delta, we saw this peak, and then it came down, but it only came about halfway down, and then it peaked again. So it's hard to know what Omicron will do. As far as whether Omicron's the end of the pandemic, I mean, we can all certainly hope so. It certainly is giving some degree of natural immunity to a lot of people, not nearly as much as vaccine-induced immunity, of course, or the best, the combination of both, if you're unlucky enough to get infected. But I think as long as we continue to have vaccine inequity, not just locally, but globally, we're going to see more and more variants continue to come. And what the transmissibility of those variants are, what the severity of those variants are, and perhaps most concerningly, what the immune evasion, whether it responds to the vaccine, it responds to previous immunity, things like that, is yet to be seen. So hopefully, globally, we can see a lot more vaccine equity and see countries that have single-digit vaccination rates get much higher.
And I'll add, Catherine, on Corey's question. Like, I certainly hope so. I certainly hope that that's the case. However, it's important that we don't let our guard down, though, right? We need to continue to encourage everyone in our community to take the mitigation steps that we've outlined here today. Number one on that list is vaccination. You know, making sure that you go out and you get your vaccines, complete the series. And then when you're done with that, going to get your booster shot, upgrading to a surgical mask or a KN95 mask when you're out in public settings, whether you're in the city of Milwaukee that has a mask advisory or not. Making sure that you thoroughly wash your hands with soap and water, taking all the mitigation steps that we've outlined over the course of the past 20 plus months in order to fight the spread of COVID-19. So we absolutely certainly hope that that's the case, but we have to continue to be vigilant and can't let our guard down now.
Thank you both. The next question is for Commissioner Johnson from Rich Rovito with Milwaukee Magazine. He says the U.S. Speed Skating Board of Directors made a last-minute decision to ban spectators and media from the Pettit National Ice Center this week for the Olympic trials. Were there conversations between the city and U.S. speed skating officials about this matter? Is this an appropriate decision?
So we were not consulted with this decision and we're not part of it. I can say that I think it's appropriate given it is the Olympic trials. The Olympics are on February 4th. The Olympians who are going to represent the US team obviously need to be negative and healthy. to compete well, but also just to even get into the country and to travel. So I understand the utmost, the desire and need to protect them as best they can. And I think this is a way to do it.
The next question, likely, Commissioner, you can touch on this. Are any conversations being had about modifying the testing process to increase safety?
It's a good question. Like I said, we have increased our MPD presence at our testing sites. I think that the issue has been that people are getting out of their cars. And so if you are at one of our testing sites, please stay in your car. It's the safest place to be, both from the perspective of spreading the virus, but also just in terms of individual safety.
We have a few follow-up questions from Ben Wagner. Dr. Weston, the first one is, with record numbers of hospitalizations, how close are hospitals to a breaking point? On Twitter, you described the emergency department recently. Are hospitals able to provide care to everyone who needs it?
Well, I would say our hospitals are certainly underwater, and they have been for a while, whether it was the Delta surge or what is primarily an Omicron surge right now. Statewide, 96% of our ICUs are full, and our inpatient beds are rising as well. And so our hospitals, I think at the moment, are doing their best to keep up, but there's a lot of mitigation measures that are being put in place to ensure that people can continue to flow through the emergency department, that we're not missing anybody with serious health conditions. And that's with boarders in the emergency department, people who are sitting there waiting for a bed and making it hard for that throughput. So I think hospitals are struggling, but I think at the moment they're keeping up. What remains to be seen is with the Omicron surge causing cases that are increasing pretty much vertically. We know what happens a couple weeks after those spikes in cases. And traditionally, that's been a spike in hospitalizations. How that'll change with Omicron, we don't yet know. There are signs that it's more mild disease. There's some confounding of that with younger populations with past infection that may create some immunity. But it seems like it's likely a bit more mild disease. But when you have such heightened transmissibility, how that translates to hospital numbers remains to be seen.
Ben's second question is, do those who received the J&J vaccine need 2 booster doses? We've heard people getting that advice from their doctors, saying J&J is not effective enough against new variants. Is this advice being embraced by all in the medical community?
I wouldn't say it's necessarily being embraced by all, because there hasn't been clear guidance from the CDC on third dose J&J boosters. I think the data is pretty good that people who got Johnson & Johnson initially to get a booster from Moderna or Pfizer seems to give you a much stronger antibody response. So I'll tell you, if I had J&J for my first vaccine dose, I would have gotten my booster from Moderna or Pfizer. And I'd be following the data real closely to see if, and following the FDA and CDC to see if that second booster is going to be effective as well. But the Johnson & Johnson vaccine is far, far better than not getting vaccinated. There's no doubt about it. But it doesn't seem to be quite as good as the Moderna or Pfizer vaccines.
Eric Gunn with the Wisconsin Examiner has a few follow-up questions related to testing data. At what point and how soon might we move from testing case by case to other means of surveillance that rely more on sampling or selected populations or settings?
I think this is a good question and something we are certainly grappling with. Historically, when a disease becomes endemic is when you transition from testing for the burden to identifying simply in a case by case basis. We are not there yet, but it is, it's something that we are certainly talking about in public health and in medicine. At what point does this become endemic? And again, at this point, we're not there. We're experiencing a significant surge, and we want to make sure that people who are positive know they are, so they can quarantine or isolate rather.
Sophia Carson with the Milwaukee Journal-Sentinel is wondering, do you expect the demand of testing to continue to rise in the coming days?
We anticipate that we'll have a high level of testing at least for the next week. I think we are still experiencing people who are gathering both for the holidays, Christmas, but also New Year's, and that as a result, we'll continue to have a pretty high demand for the at least in the immediate future through the end of this week.
Lots more great questions to come. Our next one is for Dr. Weston from Eric Gunn with the Wisconsin Examiner. He's wondering, what are the policy implications for addressing the vaccine inequities globally that you mentioned?
So I think from a global perspective of vaccine inequity, when you look at low and middle income countries and low income countries, the vaccination rates are just far, far lower. And the vaccine accessibility is far, far lower than middle, high, and high income countries. And so to remedy that, I think there's a lot of solutions. A lot of it is easier said than done. Much of the vaccine is manufactured in higher and mid-high income countries and not the lower income countries. And so getting that vaccine manufactured and then shipped, of course, a lot of this vaccine has to be shipped at in difficult conditions, extremely cold temperatures and things like that. But there's more vaccines that have come to the market that are easier to access and to ship. So that's one. I think another one is being able to have the infrastructure in low and middle income countries to distribute vaccine. There's been a lot of work on that in the past through other vaccines like the polio vaccine. And then I think increasing the messaging internationally for vaccination as well is important. Even in some countries where when vaccine arrives, there is resistance because there's been a lot of misinformation that's been discussed there as well.
Ben Wagner with WISN 12 is wondering, now that people are using at-home test kits, do you feel we have an accurate picture of how many COVID cases are out there and how widespread the situation is right now?
I do think that the picture that we are looking at that is very clear is we are experiencing a surge in cases and that there is an extremely high burden in our community. I'm not sure having those at-home tests would change that picture. I'm fairly certain that is exactly what we would learn. I do think too, there are people who are taking at a home test and then having it confirmed with a PCR test. But again, I think the picture doesn't change. We have an extreme transmission and there's a lot of virus in our community right now.
I would agree completely. Whether it's a near vertical line or an even more near vertical line, the number of cases is just extraordinary.
Dr. Weston, Eric Gunn is wondering, in a non-pandemic period, which is the typical occupancy rate for hospitals, ICUs, intermediate, and/or med-surg?
Yeah, so I've actually reached out to the Wisconsin Hospital Association to get some of that data, but it is certainly not what we're seeing now. The ICU capacities and the floor bed capacities that we're seeing now, and then not to mention the downstream effects of that, the isolations that a large number of hospital providers have to have because they themselves have gotten COVID, the mitigation and personal protective equipment measures that make it harder to care for patients. All of that is unprecedented.
Commissioner Johnson, Taylor Lumpkin with TMJ4 is wondering, do you know how many police officers will be stationed at the testing sites?
I do not, I'm sorry.
And perhaps I can jump in on that one as well, Commissioner. Look, this has been a team effort from the beginning since the pandemic got here across many different departments in the city, and of course our partners at other levels of government as well. That includes not just the health department, but even including the police department, especially now as they work to provide protection for the increase in testing that the community has been demanding. But they generally don't share specifics about deployments. I just want to put that out there that I thank the police for their efforts around testing availability here, and also want to take the time to give a shout out to our incredible staff over at the Milwaukee Health Department who have been working around the clock really for the past 2 years, working to make sure that individuals in our community have the opportunity not only to be tested, but also to get the vaccination, which again is the number one tool that we have at our disposal to fight COVID.
Thank you, Mayor and Commissioner. Our next question is from Chuck Kornbach with WUWM. He's wondering, what are the medical advantages of schools going virtual for a while? Any medical drawbacks?
Well, I think we're seeing schools going virtual for a number of different reasons. Some, and this is not just Milwaukee County, but nationally, some are going virtual to protect students because they feel that there's a heightened transmission, not just they feel that, there is a heightened transmission of COVID in their community. We just got out of a holiday period where people were gathering, people were traveling, and they want to give a little bit of cushion time before students return to classroom. Other schools are closing and going virtual because they have too many teachers that are sick, too many teachers that are quarantined or isolating, and other staff, and they can't field the in-person education that they normally could. So I think there's a few different reasons why we're seeing schools go virtual. The impact of that, of course, is significant. Virtual schooling, I think any parent will tell you, virtual schooling isn't as good as in-person schooling. It's a lot harder on the kids, it's harder on the teachers. The education is more challenging. So certainly, I don't think there's anybody who doesn't want kids to be in person in school, but it's about whether that's feasible with the amount of disease out there and whether it's safe for the kids and for the community.
Eric Gunn with the Wisconsin Examiner says, with high positivity, how do you differentiate between whether the issue is too few people getting tests versus simply a lot of spread of the virus?
So I think given the positivity that we're seeing over 34%, both in the city and the county, paired with the really high burden, that it's very clear that this is many people are infected with the virus. So again, there are tests available. We know there are long lines because there's such a demand. But again, the reality is that we have just an incredibly high level of virus in our community.
Yeah, I would agree. And I would just add to that, the commissioner was talking before about the unprecedented numbers of tests being administered. And so when you see those two together, high positivity and high testing, it's a great sign that you just have an enormous disease burden in the community. We have seen times before where the testing goes down quite a bit and the positivity goes up. And that's getting more, Eric, what you're talking about, where it's a very select population that's going and getting tested because they have really bad symptoms or they have a significant exposure or something like that. But when you see these skyrocketing positivity rates along with skyrocketing testing rates, then it speaks to that higher disease burden.
Commissioner Johnson, Corey Hess is wondering, do you think having rapid tests available at libraries, which is being proposed by one of the alders, would help?
I think it would help our community if there were rapid tests more readily available for everyone. It's something we've been working on actually internally at the health department for a number of weeks. The reality is it's difficult to get our hands on rapid tests that are packaged appropriately for individual use. But we are working on it and we're working very closely with the mayor's office. But not only, I would like to see them not only in libraries, but available also at our testing sites where they can be handed out to alleviate some of those long lines, and also potentially with our schools.
Our next question is for Dr. Weston from CBS 58. They're wondering, you mentioned you worked a shift in the emergency department. Can you describe what it's like to be a healthcare worker in a hospital at this time?
Yeah, so I worked quite a bit over the holidays. It was kind of my block to work. So I worked 6 shifts in the last week and a half, and it's busy. The emergency departments are incredibly busy. I think the amount of COVID in emergency departments is so high. It's high among very sick people who come in with COVID. And then unfortunately, it's also high of people who are coming in just to get tested. They have mild symptoms and they want to get tested. We want to have the room to care for the first category, the people who are sick, whether it's from COVID or heart issues or strokes or everything else that people have. And therefore, we want the folks who just need testing to frankly go somewhere else. If you feel that you need an emergency department, come to the emergency department. But if you are there for your mild symptoms to get a test, there's much better ways to do it, much cheaper ways to do it. And even with the long lines at testing sites, there's faster ways to do it. So we have lots of testing sites. Healthy MKE has all the testing sites listed. Every testing site on Healthy MKE is a legitimate testing site. I know there's been concerns of possible less legitimate testing sites in the county, but everyone listed on that website is a legitimate vetted testing site. So take a look there. You can find a site near you.
Commissioner Johnson, Sophia Carson is wondering, are there any plans to expand testing capacity in the city, given the long lines many places?
That's a good question. So we did expand last week both our hours at our testing sites. Then we were open on Friday. There are other testing sites outside of just the city of Milwaukee sites. So I encourage anyone to go to the healthymke.com website to find them. Some places have longer lines than others, obviously, but we have transitioned staff to support the testing. And in addition, we are working with a private lab. Hopefully they can come on board by the end of this week to open a handful of other sites in the city.
And the final question that I'm seeing right now is for Commissioner Johnson from Ben Wagner with WISN 12. He's wondering if you can have any comment on Alderwoman Dimitrievich's request to reinstate a mask mandate.
I do. My message really has not changed. Our way out of this is through vaccination. The City of Milwaukee Health Department issued a mask advisory. I stand by that. People should absolutely be masked when they're indoors. We know masks work best when you're in an indoor setting where the environment is controlled, like schools or hospitals. That's not to say you shouldn't wear a mask when you're indoors in a public setting. You absolutely should. But again, we know that is where they work best because they can be enforced. And additionally, and I've said this since this summer, my hesitation about putting a mask order in the city of Milwaukee is twofold. One, would only apply to the city of Milwaukee, and we know our borders are not fluid. But also, and more importantly to me and to the public health system in the state of Wisconsin, the public health power that is given to me through state statute has really come under question over the past year and a half, 2 years. And in fact, the Wisconsin Supreme Court decided on December 20th to take up the authority of public health officers and health commissioners in the state and potentially strip us of that authority. And it even says in state statute 25302 that a health order at this point should really be done through legislative action and through an ordinance. And I have been saying that all along. I encourage the Alderwoman to proceed in pursuing an ordinance for the city of Milwaukee.
Thank you, Commissioner. Those are all of the questions I'm seeing in our chat. So that concludes today's briefing. Thank you all for joining. Thank you for the great questions, media, and we will see you next week. Take care.
Thank you.